Welcome to part 2, where we go to the heart of the matter and look at the anatomy of the heart and its wrappings as well as the great vessels. So, the heart, as we know it, is a very strong, muscular, pump like structure. So, in order to pump blood, it has to be hollow, and because it does a lot of work, it needs a lot of strong muscles to pump that blood continuously into your circulation every heartbeat. So such a important an important organ needs protection. Thus, it has a very tough uh, connective tissue wrapping known as the pericardium. So the heart lies inside this pericardial sac. So the pericardium, by definition, is that connective tissue container for the heart and the roots of the great vessels. Now, we can subdivide that connective tissue into two layers, one from the outside and one on the inside. So you have the fibrous pericardium and the serous pericardium. The fibrous pericardium is what we see on the outside when you're dissecting a cadaver. So it's the most superficial layer that continues on as the adventitia of the great vessels. Whereas the to understand what the serous pericardium is, we go back to embryology and in fetal development when the heart existed outside of the cavity of the fetus known as the coelomic cavity. So that structure known as the heart penetrates into the coelomic cavity and carries on around it the the lining of that coelomic cavity, and that persists as the serous membrane around the heart in the adult human. Now, if you look at this picture, you can see actually they have the pericardium as we know it on the left side and the heart here on the right side, and you have a space in between known as the pericardial cavity. The wrapper of the heart, as we see it in the gross anatomical in the cadaver, consists of the fibrous layer and the parietal pericardium together. So together they form the pericardial sac. Whereas the connective tissue outside of the heart is what we call the visceral pericardium. So both the visceral pericardium and the parietal pericardium are considered as serous pericardium, meaning they produce fluid as compared to the outermost fibrous pericardium, which is just a tough connective tissue uh, protective lining around the heart, protective covering around the heart. Now, going back to this slide I showed you earlier, just to emphasize on that image number 3, that the serous membrane is actually 2 in 1. So 2 in 1, you have the membrane around the organ itself, in this case the heart, and the membrane around the heart. So in this case, the the visceral pericardium or epicardium is the one that is wrapped around the organ itself or the heart, or it's also known as the epicardium. Whereas the parietal serous pericardium is that outer inner membrane beneath the fibrous pericardium and adherent to the fibrous pericardium. Now, the heart, as it pumps every few seconds, is always in a state of friction, so it's always bumping against the pericardial sac. So, to protect both the heart and the pericardial sac, there must be some lubrication so that serous pericardium produces pericardial fluid, which helps form a kind of lubricant for the heart within its pericardial sac. So that is a potential space, a very tiny space, which may enlarge if there is an accumulation of the pericardial fluid. If the pericardium is inflamed, a condition we call pericarditis. This is one of the oldest diagrams I made for the anatomy of the heart, which shows the different layers of the heart. So going from the outside, you have the fibrous pericardium, which is adherent to the parietal pericardium. They're outlined in red. And then the exaggerated pericardial space. No, so this is not normal. This is just exaggerated for emphasis. And then wrapped around the heart is the visceral pericardium, which is also known as the epicardium. So, like most everything in anatomy, the outermost wrappings of any structure is made out of connective tissue. So, it is the visceral epicardium or the epicardium of the heart that produces the pericardial fluid to lubricate itself. Now, cutting through, so that yellow heart, which is wrapped in epicardium, now you can see a cross section. So again, for diagrammatic basis only for emphasis. So if you see the layers of the heart itself, so the outermost layer is the epicardium, and then the innermost layer facing the bloodstream or the blood in the chambers is the endocardium, which is continuous with the endothelium of the blood vessels. Now, since you need muscle, so everything else in between the epicardium and the endocardium is the muscle layer or the myocardium. Now, looking at the pericardial sac from the inside, so gross anatomy. So, other than the pericardial space, anywhere where there is a separation between the heart and the surrounding connective tissue, you have the other so-called potential spaces. So here outlined for you are two, the transverse sinus and the oblique sinus. Now the transverse sinus is just that space in between the heart and where the great vessels, the aorta and the pulmonary artery and superior vena cava are exiting the pericardial sac. So you can actually insert your finger here in what we call the transverse sinus. So sinus just stands for a space, anatomical space. So another one of the pericardial spaces or sinuses is the oblique sinus. This is just the space in between the left atrium of the heart and the pericardial sac. So it forms a blind spot or a cul-de-sac or a dead end behind the left atrium. So now we go to the different surfaces or the faces of the heart, if you think of it as the moon. So the part of the heart that faces you from different planes. So the usual anatomical position, the ones we see in the atlas, when we look at the heart, the part of the heart that faces us or the anterior surface is called the sternocostal. So logically, this just means that this is the part of the heart that faces the sternum and the ribs in front. And then, again, common sense, the surface of the heart that faces downwards, meaning looking at the diaphragm, is the diaphragmatic surface. Whereas the part that faces the spine is called the base. So this is the posterior surface of the brain. And lastly, the sharp end of that heart is called the apex. So it faces downward, forward, and to the left. So it is commonly seen in the intercostal space when you're looking at yourself in front of the mirror or when you're feeling it with your heart. So it's called the apex beat, where you can feel it with your hands on your chest. So this is just the sternocostal surface anteriorly, and this is the diaphragmatic surface inferiorly. And if you're looking at the heart from behind, this is the posterior surface of the heart.